practitioner says lack of proper remuneration, good working environment, and modern working equipment are some of the challenges facing the health sector. They called on government and all those in authority to ensure the worrisome situation is curbed as the best brains keep living in droves for greener pastures overseas. Galaxy TV correspondent Bosan Yakusak sent in this report from Kaduna.
The Nigerian healthcare industry is facing challenges associated with outbound medical tourism, deteriorating medical infrastructure, low government budget allocation, and poor compensation and subsequent immigration of skilled healthcare workers. The federal government allocated 5% of its budget to health in 2021, with little other difference compared to the 5.18% proposed for the year 2025. Healthcare infrastructure in Nigeria is still underdeveloped and lacks modern medical facilities. The country's healthcare indicators are some of the worst in Africa. Dr. Shahin Medeki, the immediate past chairman, Nigeria Medical Association Kaduna State, says there is need to address shortage of manpower. Statistics has also shown that Nigeria has only about 35,000 doctors despite needing 237,000 according to WHO figures.
If you see the global targets, we are far behind. In Nigeria currently, there is still a very high out-of-pocket spendings. And when you talk about universal health coverage, you're talking about accessibility, you're talking about affordability, and then of course, you're talking about low out-of-pocket expenditures. People, when they are down or when they need health services, one of the things they consider is finance.
The Nigerian Sovereign Investment Authority (NSIA), in partnership with the Federal Ministry of Health (MOH), has signed a series of agreements to modernize and expand healthcare services through private sector participation. The Chairman, National Association of Nigerian Nurses and Midwives Kaduna State, Nurse Ishaku Yakubu, appealed to government to deliver the capacity of specialist hospitals and diagnostic centers to provide advanced medical care services.
Go to hospital, you see simple facilities that you are supposed to use to take care of patients, they are not there. Do you understand? So this is not a good indication that we are improving. When simple tools that you need to take care of your patients are not there. Then if we also need to check, the maternal mortality rate. Is it improving? No. The rate of people dying as a result of one illness or the other is still there. You have cases of outbreaks of diseases, isn't it? You have cases of people that are collapsing and dying. So where is the medical system?
These medical practitioners call on government to start new targets to increase access to health facilities, with a specific aim to increase the number of primary and secondary healthcare centers as part of its goal to ensure access to healthcare for 100 million Nigerians.
Expectations in terms of funding. So we need to actually not just pay lip service to funding, but we need to, the political will and ought to be there for us to actually prioritize our health sector and ensure that the funding, the needed funds are made available for the health sector. Another thing is accessibility, access, and then the quality of healthcare. Where, in my own rating, I think we're still not there yet. As I said, the challenges are still enormous, especially in the rural settings. The rural settings, access to, basic healthcare is still a challenge. Many are unable to present to hospitals and actually get the quality of services.
Raising infrastructure, building hospitals, upgrading the existing ones, renovation, and buying equipment that will be used to take care of the patients. Then training and retraining of the health workers that are already employed on ground, because some of them carry obsolete knowledge. So they will need to be trained and retrained to meet up with global standards. Then thirdly is employment of health workers.